Hello mga friends! Kumusta kayong lahat? May bagong awareness naman tayo ngayon. Tonight guys, I'm gonna share with you ang therapeutic use of heat and cold. Sometimes, hindi natin alam na meron palang mga part na hindi pwede yung heat or yung cold. Okay? So I'm gonna explain this to you para bagong awareness naman natin or alam naman natin or maybe this is just refreshing para sa ating lahat, okay? Heat and cold are simple and very effective therapeutic tools, can be used in our whole body. Proper application of heat and cold can provide pain, relief, decrease swelling, help injuries, heal faster than normally we do, help raise or lower our body temperature. Okay? In proper application, guys, of heat and cold, like any improper, IMPROP, ang hindi tamang paggamit ng heat and cold, like any improper application of therapeutic technique can be harmful, yes, and cause a tissue damage and other injuries. Some uses of heat and cold are safe, simple, but there are ways to use heat and cold as therapies that are complex. Basic principles of heat and cold can be very effective therapeutic tools, yes. In order to gain the benefits and avoid the risk, yes, we must first understand why these therapies work. Napakahalaga guys na naintindihan natin. Body temperature. A balance between the heat in our bodies produce and the heat we lose. There are many ways we can increase or decrease the amount of heat we produced. There are also many ways, we can increase or decrease of heat we lose. Some of this we can control by drinking hot or cold liquids, putting on or taking of clothing, yes, but the one we are concerned about here are the involuntary and involve the blood vessels of the circulating system. Yan ang concern natin. Minsan, kung sa Bisaya pa sa Ilonggo, napataka-taka lang tabla apply, yan. Nagpataka-taka lang ta, but that pataka-taka apply is doesn't, hindi pala pwede yon. Ayan. So the blood vessels of the circulatory system are very effective tool for conserving or losing body heat, and they do this by dilating, expanding, or constricting or narrowing. Yan. When the blood vessels dilate, more blood is brought closer to the surface of the skin. When that happens, the body heat we produce is transferred through the blood and escapes to the environment. When the blood vessels constrict, the blood kept away from the surface of the skin, so our body heat cannot escape. The dilation and constriction, guys, of the blood vessels is an involuntary reaction and is one of the many methods the body has for maintaining a stable and optimal internal environment. An injury to the body can take many forms. Halimbawa, lacerations, burns, breaks, sprains, infections. When injuries occur, two things happen. First, there is pain. Of course, there is a pain, masakit. there is an injury is caused by what? Damage to tissues, blood vessels, and bones. Second, the body makes attempts to heal and repair the damage. One of the ways it does this is by dilating the blood vessels and in around the damaged area and increasing the blood flow to the damaged area. This helps the healing process by bringing oxygen and nutrients to the injured tissues and removing toxic waste products. However, guys, the dilation of the blood vessels and all of the increased blood flow actually causes pain because of what? Dilation of the blood vessels and the increase of the amount of blood in the area causes swelling and pressure to be applied to the area of injury. Think about it. If you have sprain sa inyong ankle, you won't walk on it, di ba? Hindi ka makalakad. Because you are weight-bearing causes pressure. And the pressure causes what? Pain. Di ba? So how do these concepts apply to the therapeutic use of heat and cold? We use heat, okay? We want to increase the blood flow. Kaya kailangan natin ng heat to an area because the heat dilates the blood vessels. Okay? Ulitin ko, napakahalaga. Ginagamit natin ang heat because we want to increase the blood flow to an area because the heat dilates the blood vessels. Kailan naman natin dapat ang correct na paggamit ng cold? When we want the blood flow, okay, when we want to decrease the blood flow to an area because cold constrict the blood vessels. Okay? Tandaan, pag heat, we want to increase the blood flow. Pag cold, we want to decrease the blood flow to an area because cold constricts the blood vessels. Okay? We use either heat and cold depende sa situation, of course, ng injury. Heat would be applied to tissues that are affected to bring oxygen, nutrients, white blood cells that fight infections to the affected area. Cold would help an area that is painful because of swelling. Sprained ankle, yan, to decrease the blood flow to the area and to decrease pressure. Okay? Heat and cold can be used sequentially. Standard care for a sprained ankle is to first, anong dapat i-apply natin? Di ba? Nagka-sprain yung ankle natin. We need to apply what? Ice. Ice for a few days. Bakit? To decrease the what? The pain. Pain. Bakit nagkaroon ng pain? Ano ang cause ng pain? Swelling. Ayan. So then, apply heat naman to increase the blood supply and promote healing. Okay? I hope guys naintindihan natin yan. Heat and cold can be used safely. Yan. But these therapies can also harm if not used appropriately. Kaya yung sinasabi ko, magpataka, dili jud ta magpataka-taka guys pag-apply sa mga heat and cold because there is reason or purpose of using that. Ang pag-apply ng heat and cold, it is your doctor's order. Ang doktor lang guys makapagsabi. Kaya ayaw jud pataka. Ayaw jud mo guys pataka. No. Ayaw pataka. Always follow your doctor's order. Okay? Always consult your doctor. Always balik lagi sa doktor kung merong tanong. Ayan. Paano? How to use it? Moist and dry heat. Halimbawa, doctor's order. Paano gamitin? Moist and dry heat. Halimbawa, apply 4 times a day for 20 minutes. Hindi pwede na isang oras. May particular yan, guys, na time per application. Halimbawa lang yun, ha? Ayun yun mo, guys. Pataka-taka diya, guys. Do not apply directly to the skin. Be careful when applying heat in cold to elderly because their skin is delicate. Sa mga infants and children, their skin are very sensitive and can easily damage. Dementia or disoriented persons, they do not know or hindi nila alam na injured sila or unable to communicate sila about their pain. So ito siya hindi din maganda sa kanila. Be very, very, very careful when applying heat to those who have diabetes. Bakit? Diabetes decrease circulation and interferes with the sensation of pain. And this makes the patient with diabetes more susceptible to harm. Hindi nila, and they lose hindi nila yan mapapansin. If heat and cold is improperly applied with diabetes, she may suffer an injury, but not realizing the presence of pain until the damage has been done. Ayan. Kaya guys, marami guys na minsan taka lang ta guys, no? Nagbanog imong tiel, nagbanog imong kamot. O sige, ali butangan nato kuan kanang maghatta or mag-cold ta, no. You have to consult your doctor, okay? Don't apply heat in cold to irritated skin. Don't apply with stitches. Yung may mga tahi-tahi dyan, yung may mga surgical wound, unless there is a doctor's order. Everything is doctor's order. Never apply moist, heat, and cold to a damaged skin or an area with stitches, open wound. The moisture can cause infection and prevent healing. Kaya nga minsan yung mga pasyente, meron silang galing ng hospital, di ba? May mga bandages sila. There are certain days na hanggang kailan lang yung mga bandage doon. Kasi once na mag-moist na guys, yung sugat, infection comes in. And heat and cold should be applied for a specific time, no more than 20 minutes. No, that's it. Bawal ng 25 minutes, hanggang 20 lang. And cold therapy used to decrease pain that is caused by swelling, by the sprain, or a fracture. Okay guys? Ito napaka-basic lang, pero minsan hindi natin alam. So, ito siya guys, is a very basic information, and please share this to your family and friends. Kasi minsan guys, yung ating pataka system ba, magsigil lang tagpataka-pataka and result with an injury. So, ito siya magandang magandang vlog to. Share this to them. Thank you so much. Please don't forget to comment below, like, share, and subscribe. Thank you for watching.